Steger here with Susquehanna Spine and Joint. Today we're going to go over some stuff you can do to help with shoulder pain. Most shoulder pain is not structural, which means it's not a rotator cuff tear or a torn labrum. That's more of a trauma that would cause that. A lot of times it has to do with the biomechanics of the shoulder, which means you have certain areas that are tight and certain areas that are weak, and it's throwing off how the shoulder moves, causing the pain. So to fix those issues, we're going to use a lacrosse ball and different stretch bands here to treat the shoulder. So first what I'd like to do is just do a real generic exercise you've probably seen before, just to warm the shoulder. So if you visualize the shoulder as like a piece of plastic, when you get plastic nice and warm, it becomes pliable or stretchable. So we're going to work internal rotation first, just like this. With this internal rotation, you want to do high reps, probably enough to feel a burn, maybe like 2 sets. So you're going to internally rotate, so you feel a nice burn, getting the blood flow in the area, getting it nice and warmed up. Then we're going to do the external rotation, just like that. So that's working the rotator cuff here, the supraspinatus and infraspinatus teres minor, and then coming in like that. That's the subscap. So once you get it warmed up, we're going to do a real basic stretch here. We're going to stretch external rotation, internal rotation, as well as axial traction, or tractioning just out. And when you traction it out, that's really good for the actual capsule, or the tissue that actually surrounds the ball and socket joint. So the first way we like to stretch, for this, you're going to let the arm come up, and you're going to lean forward, and that's going to kind of help stretch that external rotation as well as that lat muscle here. So you want to hang out there for at least 2 minutes to stretch that. Next step is for the internal. I'll switch this here. You can do it up there. You can also just do it at shoulder level. I'm going to do shoulder level here for you. So once again, you can hook it like this. That's going to be nice external rotation. So stretching your shoulder out that way externally. Next, internal, just like this. That's going to stretch the internal part. Once again, you want to do it for 2 minutes. And this is axial. This is going to get the capsule and really work the whole rotator cuff. It's going to wrap your wrists in there so it's not going anywhere. And just lean all your body weight, just totally relax that shoulder. It's going to traction out that capsule. Once again, you hold it for 2 minutes to loosen it up. So once you get that global stretch, now you want to find the real tight areas that aren't functioning properly, which is more often not right back here. This gets really weak and tight, and when that gets weak and tight, actually your shoulder's going to rotate forward. Then you're going to get compression through here, causing anterior shoulder pain, as well as pain when you lift your arm, which means that rotator cuff is not pulling that shoulder, the head of the humerus, the top of that arm bone in, so it's pinching right through here. So what we want to do is we're going to just really get the lacrosse ball in there. You're going to put it through here, pull your body weight in there, compress it. That's going to really help to stretch it out. Then next we want to work the levator scapula, this top shoulder muscle here. So when this gets tight, it's going to pull that shoulder blade forward. Once again, that shoulder blade comes forward, it's going to cause pain and compression in the front. So the first move we want to do has a fun term. It's called a sleeper stretch. Basic stretch is like this. Just get the shoulder underneath. You're going to push down and hold like that for 2 minutes. And that's going to stretch that posterior rotator cuff. The next step is you get that ball that we're talking about, put it right at the back of that humerus, back of that arm bone. You're going to compress it, then you're just going to work that range of motion. Find your tender spot, and then work through there. That's going to loosen that up. It's going to let that shoulder retract back, alleviate some of that pain in the front. So that's the first part. The second part is we get it right at the top of the scapula here. So you get all your weight up on it. You're going to find that muscle. You're going to put your weight, compress it, and you're going to lift your arm above your head. So compress and lift. When you lift your arm up, it's going to pull that shoulder blade down, and the ball's going to push that muscle. It's going to help pull it apart. So compress and then lift, just like that. So now that we mobilized it, next we want to strengthen it. There's a lot of different shoulder exercises you can do. I'm going to just go through some of my favorite ones. One of my favorites is a real simple one where you can work the whole entire shoulder. So you're going to pinch. That's going to be between the shoulder blade muscles. So pinch, then you're going to rotate up. That's the rotator cuff. So it's kind of a two-part exercise. Pinch for the shoulder blades, then rotate up for the rotator cuff. You can add some variation too, where you can pinch, rotate, and then press up. When you press up, that's going to make the shoulder work even harder. So you probably want to do maybe 3 sets of 20, a higher rep, just to really stimulate the muscles in the shoulder. So you have the pinch, rotate, or the pinch, rotate, and press. The next one is we're going to pinch and then rotate down, and that's going to get the second part of the rotator cuff. Pinch and rotate down. Once again, that's going to be the muscle underneath the shoulder blade, the subscap. So once again, pinch, rotate down. Once again, do about 3 sets of 20. Pinch, rotate down. It's like that. I like that for the rotator cuff, as well as between the shoulder blades. This other one here is a variation of that, but it's pretty effective. We're just going to go just straight up with it, just like that. That's called the Y exercise. Pull it just like that. That's going to work on the whole overall mechanics of the shoulder. This will really help you retract it back. The reason why you want to do it is you track that shoulder blade back. Once again, it takes the pressure off here because most people have shoulder pain in the front. So once you get the shoulder blade coming back, the rotator cuff pulling it back, it's going to fix the biomechanics, help with that shoulder pain. So hopefully it helped you guys out. For a free consultation, give us a call.